Ovarian cancer is often described as a disease that's diagnosed too late, but that's only part of the story. Because it's not that the signs aren't there, it's that they're easy to miss, easy to dismiss, and too often not taken seriously until it's already advanced. Why is that? What can we do to prevent and diagnose the disease earlier? Those are the topics for today's discussion. Hi, I'm Dr. Mitzi Krockover, and welcome to Beyond the Paper Gown. Today's conversation is one that feels both deeply personal and incredibly important. Ovarian cancer has touched far too many lives. In the past 5 years, I've lost 2 good friends to the disease, despite their having access to the best care available. My guest today is someone who has dedicated her professional life to change the trajectory for people with ovarian cancer and the caregivers who support them. Robin Cohen is a nurse, a global advocate, and a leader in the ovarian cancer community. She currently serves as chair of the World Ovarian Cancer Coalition and is the CEO and co-founder of the Sandy Rollman Ovarian Cancer Foundation. In this conversation, we talk about everything from risk and prevention to the realities of diagnosis and treatment, the promise of new therapies, and the very real gaps that still exist, globally and here at home. Just a reminder that this episode is for informational and educational purposes only and is not to be considered medical advice. I encourage you to discuss any personal medical issues with your healthcare provider. Thank you so much for being here.
Thank you for having me.
Of course. As I alluded to, you've been a nurse, an advocate, and really a leader in the global ovarian cancer movement. Talk to me a little bit about what led you into this kind of advocacy, and as well as the story behind founding the Sandy Rollman Ovarian Cancer Foundation.
So my background is GYN oncology nursing, and I was Sandy Rollman's oncology nurse. She passed away from advanced ovarian cancer at the age of 32.
I'm sorry.
And I became really close with her, and I really learned, by taking care of Sandy, I really learned what wasn't available to women with ovarian cancer. And after she passed away, I had a lot of fight left in me. But I was also a very young nurse, and I knew nothing about starting a nonprofit or running one. And at the time, I was taking care of another patient. Her name was Regina, and we called her Reg for short. And I wanted to be Reg when I grew up. She was a stylish woman, had a lot of spunk, and I went into her room, and I sat down next to her on the bed, and she was dying from ovarian cancer. And I told her my dream. I told her what I wanted to do. And it took all of her strength, but she lifted herself up out of the bed. She grabbed onto my shoulders and she shook me. And she said, "You go out and you fight for us." That was the last time that I saw her, but I have lived those words every day since. I go out and I fight for these women. And I have since learned that a lot of the nurses told Reg all of their secrets.
Both Reg and Sandy sound like amazing women, and I'm sure they would be very honored by what you've done in their names. What year was that you spoke with Reg, for example?
That was 2000.
Okay, so you've been doing this for 2 decades plus.
Yeah.
Okay, and so you've really seen a lot of changes, I would assume. I say that, but it's kind of like, and then there's not so much change as we would like, right? Either in terms of diagnosing, treating, and preventing ovarian cancer. So how would you respond to what I just said?
I'd say the change doesn't come soon enough. We're still losing incredible women. Sandy was the reason I became involved, but it's the women and families that walk through my door that have kept me involved. And I have lost a lot of friends over the years, and it's a punch in the gut every single time.
I have had 2 close friends in the last probably 7 years pass away of ovarian cancer.
I'm sorry.
Thank you. I want to talk about the fact that you're not only a U.S.-based foundation, but you chair the World Ovarian Cancer Coalition. And so talk a little bit about the numbers both in the U.S. and globally, and how those populations may be a bit different, the same, and why you chose to really focus your attentions on a more global scale.
Yeah, it was kind of a natural progression for me. I've been in the advocacy world a long time, and I've worked with a lot of patients and clinicians. And so when the opportunity came to join the World Ovarian Cancer Coalition board, it was a natural progression for me. And I think they asked me to join the board because I did have such a strong advocacy background. And I've learned so much by being on the board and now being chair, because sometimes it's really important to get out of your own world. So, I mean, the statistics are staggering. You know, most women are diagnosed at an advanced stage. In the U.S., 1 in 91 women will hear that they have ovarian cancer.
1 in 91.
1 in 91.
That is not insignificant. I think
No.
that even physicians may feel that it's much more uncommon or rare than those numbers would suggest.
Yeah, and I think, you know, most of us know if you think about it, most of us know 91 women.
Yeah, of course.
So chances are one of those women will be diagnosed with ovarian cancer, and chances are she'll be diagnosed at an advanced stage.
Are there any differences between, say, the numbers here in the United States versus elsewhere?
There are in survival rates. Like, you know, other countries have much poorer survival rates than the United States because of less treatment advances, less access to genetic testing. PARP inhibitors are not available everywhere. Mm-hmm. There's lack of awareness, but interestingly enough, there's significant lack of awareness in high-income countries and low-income countries.
What does the coalition specifically do? What are some of the activities that they engage in?
So we ensure that every woman, no matter where she lives, has the best chance of survival and access to the best care possible. And also every woman at risk has the best chance of survival. So we've done 2 studies. One, the Every Woman study. We did that in high-income countries in 2018, and we just completed last year the same study in low to middle-income countries. We surveyed over 2,500 women in 22 countries. And we found that there was significant lack of awareness. There was significant delays in treatment. There was significant delays in the time of diagnosis to starting treatment, lack of genetic testing. And so now we are putting that data that we collected into action. And we are, through that study, one of the countries was Nigeria. And through the study, we met clinicians, we met patient advocates, we met government officials, and the Nigerian pilot program was born from that work. And now we're working with those people, significant people in the government, patient advocates, clinicians, to raise awareness in that country, to provide better access to care, better access to genetic testing. And then we'll be able to use what we learn there and take it to other countries. But it's really important to have the people within the country engaged in the process.
That's a good lesson, absolutely. And then what does the foundation do?
We are the facilitator, so we are not going into a country making those changes. We are working with the people that live in those countries to effect change. We also provide the data needed to effect change. We did a socioeconomic burden study of ovarian cancer, where we studied the cost of ovarian cancer in 11 countries, and countries can use that to influence policymakers to make changes.
Okay, so you do that through the Sandy Rollman Foundation?
No, through the World Ovarian Cancer Coalition.
Okay. And then thank you. And then what about the foundation?
So my organization, we support women and caregivers impacted by ovarian cancer, and we also raise funds for ovarian cancer research.
Terrific. Let's back up then and talk a little bit about ovarian cancer itself. And let's start with just even screening to identify something either before it occurs and or at the very earliest stages so that you can treat it and hopefully treat it more successfully. And as you noted, most ovarian cancers are diagnosed at a later stage and therefore more difficult to treat. So what are your thoughts about screening right now and anything on the horizon that you feel like might be promising?
Yeah, so there's no screening test for ovarian cancer, and that is the challenge, and that is why it is diagnosed at the advanced stages. I think that prevention is really important, so really knowing your family history, knowing what preventative strategies may be appropriate for you, because we don't have a screening test. And, research is being done in the field for screening, but it's been a slow process, so that's why prevention is so important.
Okay, so it's interesting that you chose the word prevention. I think people would be real surprised I can prevent ovarian cancer. So let's even roll back a little bit more. And if you could remind us what the risk factors are for ovarian cancer and then how you might use that information to prevent it.
Sure. So personal or family history of breast or ovarian cancer, increasing age, not bearing a child, obesity, smoking, are increased risk factors. So certain risk factors, you can't prevent, but if you have a personal or family history, if genetic testing is accessible, that's really important information to have. Some research indicates that over 20% of ovarian cancers are genetic. So, and in most cases, the word ovarian cancer doesn't enter a woman's vocabulary until after she's been diagnosed with the disease. We might go to the gynecologist and have a conversation about our breast health, but we don't talk about our ovarian health, So
Sure.
That's important. Have a conversation about ovarian cancer.
Right. I think that there was a bit of increased awareness after Angelina Jolie was diagnosed with breast cancer and then did her genetic screening and chose to have an elective removal of not only her breast but also her ovaries as a preventive measure. Do you want to comment on that?
Yeah, no, and I commend her for going public because that really raised the profile for women who have a genetic mutation. I think, look, it is an individual decision. It's a conversation to be had between you and your physician. Now there's a recommendation that if a woman is already undergoing a abdominal procedure, that she has her tubes removed preventatively, regardless of if you have a genetic mutation, because there is no screening test.
Most people think, okay, that genetic mutation is really only in a certain segment of Jewish people. For my friend, what she didn't know was that she had a Jewish lineage, and it ended up that she was positive for the BRCA1 mutation.
Yeah, and it's also important, it can come from your mother's side and your father's side.
Exactly. I'm surprised also that it's so little in terms of the genetic component, or being only about 20% of the ovarian cancer cases. What other commonalities are in the other 80%?
So, and that's what's important. All women are at risk for ovarian cancer. It can be, I always say it's like a stranger coming in the middle of the night. And it can forever change your life. So it's important to know about the disease, to be aware of symptoms, and to know risk factors. But all women, most women have no risk factors. Most women diagnosed have no known risk factors.
Talk a little bit about symptoms.
Yeah, symptoms are, abdominal bloating, a feeling of fullness, abdominal pain, urinary frequency or urgency. So they're a bit confusing because most women experience those symptoms sometimes monthly. So it's really important to know your body, to know when you know yourself on a good day, you'll develop almost a sixth sense when something isn't quite right. And to be your own best advocate. Chances are you don't have ovarian cancer, but make sure you don't have it, to just really be aware of your body and be your own best advocate.
And to that extent, if you're having symptoms and you're checking it out, it's no longer screening, it's really looking for a diagnosis. And so what are some of the ways that a physician might diagnose ovarian cancer that, if you were to go in with some of those concerns, you would be expecting to have done?
They generally do an ultrasound, a CA-125 blood test, a CAT scan, but the most definitive way to make a diagnosis is through surgery.
Okay. But correct me if I'm wrong, you're really not going to do surgery unless you see something that is questionable on some of those other imaging modalities.
Correct.
Great. Talk about the risk or the prevention aspects of things like oral contraceptives.
So oral contraceptives can decrease your risk of ovarian cancer. Any interruption in ovulation lowers your risk. So oral contraceptives, even taken for 5 years, it doesn't have to be 5 years in a row, can lower your risk by 50%. Having lots of children can lower your risk. So any interruption, but we're not going to tell someone, to have 10 kids.
Exactly. There's other issues involved with that.
Yeah.
Okay. In medical school, we were taught that, for example, nuns were being overrepresented with ovarian cancer, probably for those exact reasons.
True. Yes.
Okay. Any other preventive measures?
Having your tubes removed is a preventative measure. Living a healthy lifestyle, diet, exercise. It's not 100 way. It's not 100. There's no way to prevent it with 100% certainty, but it can lower your risk.
Okay, thank you. Say that you've now been given a diagnosis of ovarian cancer. What does one do next?
So it really depends on the stage, usually it's really important to see a GYN oncologist who specializes in women's cancers. And either a woman would have surgery followed by chemotherapy, or chemotherapy first followed by surgery.
I mentioned earlier PARP inhibitors because that seemed to be a real game changer. Can you talk a little bit about the importance of those and what they are?
They came, we hadn't had a new treatment for ovarian cancer in a long time. And so that's an extra insurance policy for maintenance therapy for women who have a genetic mutation to prevent a recurrence. Yeah, it's and we actually just had another drug approved, got FDA approval for low-grade ovarian cancer, actually on World Ovarian Cancer Day on May 8th. So there are new treatments coming on the horizon, which are very exciting.
I spoke to a colleague of mine who is a women's health internist, and she made the comment, ovarian cancer, when it's treated and treated appropriately, we're really seeing it be more of a chronic disease. And so that was really an interesting comment, I thought. Can you comment on that?
The thing about ovarian cancer is because it's diagnosed at an advanced stage, it usually recurs. So it usually comes back, and it's a never-ending disease. But with more treatments, women are living longer.
There's also newer drugs like ADCs. What are those?
They're anti-drug conjugates, and they're actually for women who have received several rounds of chemotherapy. So it's actually really great because for years, there was nothing for women who had several recurrences. and these drugs are for them. Pretty much every pharmaceutical company has an ADC that's about to come onto the market. So we have to see where
Sure.
which ones have success. But there are a lot coming, and that's why the research is so important. We've investment into ovarian cancer research is really important. And in the U.S., we've seen that those research dollars cut significantly in the last few months, and it's really going to halt our progress.
Let's shift a little bit to policy. What would you like to see?
I would like to see our funding restored.
Yeah, exactly.
I would like to see women's health get the attention that men's health gets. It's significantly underfunded, but cancer affects everyone. Everyone knows someone, and I do not think that anyone would be in agreement for cutting cancer research dollars. It just makes no sense whatsoever. I mean, we are not only hurting this generation, but we're hurting future generations. And there's going to be a time where it's going to be too late to do something about it. So it's really urgent that we do something about it now.
What do you mean it might be too late?
Well, the research labs are going to close. I mean, research is going to stop, and researchers who have been in the field for 30 years are going to close their doors. And that progress that we've made is going to be gone.
And a lot of waste of those dollars that helped to get us to that period of time, or to that point in time.
And just the work. I mean, the passion that these researchers have. It's about the patients. And it's just really upsetting.
And I know that you've, advocated. What has been the response to lawmakers when you have a one-on-one with them?
Generally, it's positive. I mean, I've gone to Capitol Hill several times, to fight for funding. And, like I said, everyone knows someone. Generally someone in their family has had cancer. So, it's a bipartisan issue, and they've all been positive meetings.
But have they translated into action?
They have prior to we have had increased funding for ovarian cancer research from the federal government and up until now. And
with so many issues, one focus on one area usually leads to more information about others, conditions and processes. Is that what you're finding as well?
Absolutely. Yeah. In some ways, ovarian cancer is a complicated disease. There's 20 different types of it. So there's not a one-size-fits-all treatment. And in some instances, certain types of ovarian cancer are more similar to other cancers than they are to another type of ovarian cancer.
Has there been any promising vaccines, mRNA or otherwise, cancer vaccines?
There have been cancer vaccine trials, yes, definitely. And they're in jeopardy now, too.
Yeah, it's a shame. Well, staying on that topic of research, one of the things, obviously, if someone were to be diagnosed and they're talking with their oncologist, that they might be offered clinical trials. So talk to us about what that means, what they should be asking in terms of that.
I would suggest to have a conversation about clinical trials at the time of diagnosis, whether it's appropriate for you at that time or not. Years ago, we actually developed a clinical trial at Sandy Rollman, a clinical trials pocket guide for women to take with them to a doctor's appointment. And the guide came out of roundtables that we conducted at our office with patients and caregivers. And I remember there was a young woman, she was in her 30s, sitting across a table from me, and she said the words, "I wish I would have known." And I thought to myself, I never want to hear another woman say that. So to get that information when you're diagnosed, so that you don't necessarily miss out on an opportunity, and to really, it's difficult to navigate treatment decisions, but I think when you make the best decision with the information that you have today. But you have to have the information in order to make that decision. And also, everyone is an individual, so people make decisions very differently. So you make the decision that's appropriate for you.
Sure. And now we have other opportunities other than just talking with our physicians. And again, I'm thinking about maybe somebody who is not in an urban center, and may or may not have access to that physician who can talk to them about that. So what other resources would you suggest that they go to just to have all of that information that maybe then they can share with their oncologist if they're not being given that information by the oncologist?
I think there's a lot of support groups and advocacy groups that can provide that information. I always worry about the woman that's not around the table, that's not in the support group, that's at a community hospital or in a rural area in a poor country. So to make sure that she has access to what's available is really critical.
What about the role of like clinicaltrials.gov as well as ChatGPT?
Yeah, ChatGPT I think is probably going to on the newer side, but people are are using it. Clinicaltrials.gov, it's not very user friendly for patients. So one thing that we did at Sandy Rollman is we've created just a site for physicians to access clinical trials in their area, so that when a woman in their location comes and says what clinical trials are available in our area, they have access to that, and the community physicians also have access to that.
Okay. And you've talked about the caregivers and that you're very involved with supporting caregivers. What do those caregivers need in order for them to feel supported?
Yeah, I think they need understanding. Sometimes it's harder to be a caregiver than a patient, and also financial support at the workplace. The socioeconomic burden study that the World Ovarian Cancer Coalition conducted actually measured the financial burden of the caregiver as well as the patient. It was really the first time that was done. And it was significant. I think the caregiver missed 33 days a year of work. So really a lot of support, and sometimes because ovarian cancer is a never-ending disease, it's very often the caregiver that is navigating some of the treatment options. So education about clinical trials, insurance issues, cancer in the workplace, and also just peer-to-peer support. Talking to another caregiver is really helpful.
Sure. And you talked about, a lot of what you just talked about is not specific to ovarian cancer, and I think you kind of alluded to that.
I always say to a woman, find your people. Whether it's in the waiting room, whether it's in a support group, whether it's in a kitchen, but if you can find one other person that is going through or has gone through what you have, it's really helpful. It's all about the support. Sure. And knowing that you can get to the other side of things.
Well, and to that point specifically, you also talked about a little bit about support groups. And so how would women who, caregivers or patients themselves, find support groups?
Through advocacy organizations and through where they're being treated has support groups or has a list of advocacy organizations. Many of the support groups are virtual now, so people have more access. You don't necessarily have to be in the physical location, which is great. So it's just really, and a support group isn't for everyone. Sometimes a one-on-one is better. Sometimes, especially at a time of initial diagnosis, just talking to one other woman who's made it to the other side.
For listeners who want to make a difference, what would you say to them, and how would you suggest that they engage?
I think that, first of all, everyone can use their voice to raise awareness. There is a significant lack of awareness for ovarian cancer. People can volunteer. There's many advocacy organizations around the globe, always looking for volunteers. If people have the capacity, they can make a donation. So there's many ways to give back. We really need an army of people.
Are you aware of any specific innovations that you're specifically excited about, or the kinds of things in addition to the therapeutics that are on the horizon?
Yeah, I think the use of AI in screening may be something to keep an eye on. I think there's going to be more. Yeah,
because I think, again, part of the challenge is that, maybe I'm speaking for myself, but I don't think so, we think about women at risk as being, again, those carriers of a genetic mutation, as opposed to that, statistic that you said, everybody is at risk.
All women.
And so if we, and some of the risk factors that you mentioned are kind of risk factors for a lot of things. And so the holy grail is to find a screening tool that we could screen everybody that's cost effective.
Yeah, absolutely. I mean, if there was just a way to visualize the ovaries on a scan, it's complicated, but a screening test would be the game changer.
Sure. What did I not ask you that you think is important for our audience to hear?
I think the World Ovarian Cancer Coalition recently formed a global expert group of patient advocates, clinicians, policymakers across 13 nations, 6 continents, all coming together to work on increasing awareness about the disease, improving diagnostics, and improving care for women at risk and with genetic mutations to access to that care. So that's really important. I think that will really affect change. Getting the right people around the table is important. And I think that's going to really make an impact.
Robin Cohen, thank you so much for your expertise and your passion and your advocacy. I know I learned a lot during this conversation, so thank you so much.
Thank you.
I want to thank Robin Cohen not just for this conversation, but also for her advocacy and work through the World Ovarian Cancer Coalition and the Sandy Rollman Ovarian Cancer Foundation. Here are a few takeaways from today's episode. First, awareness matters, because too often, ovarian cancer isn't even part of the conversation until it's too late. Second, knowing your body and advocating for yourself is essential. If something feels off or different, seek medical attention and advocate for yourself until you get an adequate answer. And finally, none of this happens in isolation. Whether it's research, policy, caregiving, or support, this truly takes a community. The good news is that there are not only new therapeutics on the horizon, but also new diagnostics. I'll bring this information to you as it becomes available. And if this conversation resonated with you, I encourage you to share it, because the more we talk about these issues, the more we build the awareness that creates change and progress. And while you're on your podcast platform, please subscribe and rate our podcast. You can also join our mailing list at beyondthepapergown.com to keep up with this topic and more. Thank you, and take good care. This episode was produced by me and Patrick Shambayati, and our associate producer is Kyla McMillian.